The full name of our company is Employers Committed to Control Health Insurance Cost. And the acronym is ECCHIC, and so we're referred to as the ECCHIC Group. But that stands for Employers Committed to Control Health Insurance Cost. I wanted an identity in this business that goes beyond the usual generic benefits plus, benefits unlimited, we do benefits, and all that kind of stuff. We are focused on showing small and mid-sized employers of all types, regardless of where they're located, how to use the health insurance system that encompasses the medical and the pharmacy world, the same way large employers do, to be able to get the same benefit and the same the institutional discounts that are hidden to a small group by virtue of the premiums that are presented to them by what agents and representatives bring these kinds of programs to the table, which is what they are trained to do and what people are indoctrinated to look for. Just at lunchtime today, I had lunch with someone wanting to find out a little bit more about what we do, who happens to be an insurance broker and has been for quite some time. And I asked him a simple question with regard to the structure of what's buried in these premiums. I said, well, let's take a very, very simple component here, which is prescriptions. And everybody goes running to insurance agents to get policies that'll cover all their prescriptions. They know what their premium costs. They know what their copays are. They have no clue what the prescription actually cost is because, quote, their insurance pays for it, but in a roundabout way, no, it doesn't, because whatever the cost of those prescriptions are, it's baked into the premium. And prescriptions are a fixed expense because they're almost all maintenance drugs anyway. So I asked him a very simple question. I said, all right, look, let's say that you're a business owner and you're providing a benefit to your employees, maybe 8, 9, or 10 of them, and the premiums that you're paying are $15,000 a month. And you get a bill for $15,000 a month, and you have insurance, and that's going to cover your prescriptions. Now, as a business owner, you want to know what you're being charged for what products you're buying and what you're being charged for. Well, you as the business owner in paying that premium are buying prescriptions from an insurance company. You're just picking them up at the pharmacy because the cost of those prescriptions are built into the premium that you're being charged of that $15,000. You don't have any idea what you're being charged for that prescription, but you went to your insurance agent. All right, now here's the question. If your group are buying a certain component, a certain collection of prescriptions for various needs, from diabetes to high blood pressure, where are you going to get better advice and a better result because you get a better value? Going to a licensed pharmacy professional for advice and guidance, or a licensed insurance agent for a premium? And he says, what every employer says, well, a pharmacy. That's the right answer. Now answer this question. Then why do you keep going to an insurance agent? You're just going to the pharmacy to pick it up. You're going to the insurance agent for the advice. You don't know what you're buying. You don't know what it costs, but you want to control the cost. Well, let's start there. So this afternoon, for a 9-person group, one of our groups is in Central Illinois, and they have 9 people, and we kind of inherited this group, and they have Blue Cross, and that's what they've been used to. Ultimately, that's going to change. Now, for 9 employees, and a couple of them have families, the premium is $12,000 a month. Think about that. $12,000 a month. That's $144,000 a year. If they get a 0 increase over the next 5 years, 0, they're on track to spend $750,000. They have no idea what they're buying, no idea what the cost is. If they have a 0% increase, it's $750,000. All right? Well, we just got the renewal from Blue Cross. Nice package, nice cover letter. Thank you very much. Costs go up, and we're just going to hit you with a 22.9% increase, or $3,000 a month, or $36,000 a year. For what? Did I tell you what you bought for $144,000? Did I tell you why they want another $36,000? Are they giving you any information other than, thank you very much, here's your deductible, here's your copay? Who buys anything that way? I'll tell you who. Everybody who buys these policies from these insurance companies. That's how. I went back to their representative just more than an hour and a half ago. I said, look, I don't want to hear excuses, and I don't want to hear all this talk about this, this cost going up and that cost going up. And, if they raise the deductible instead of 22%, it'll go up 15%. I want some facts. And I know doggone well I'm not going to get them, but I want facts. Okay, what did this group buy for $144,000, and what justifies another $36,000? This is a small company. If you take a look at this in true dollars, and let's assume, and they're a small manufacturer, so their net bottom line, after all expenses, is probably about 7 or 8%. Let's just round it up to 10. Let's say they're really, really in a very, very good marketplace, and their net is 10. That's not a $36,000 a year increase. That's a $360,000 a year increase, because that's what they have to generate in revenue to net that back to the bottom line. Now, take that increase over 5 years. That's $2 million that they have to increase their revenue to net that back to their bottom line if they don't go up from there. I think about this dynamic. Now think about this dynamic when a group has 50 employees and their premiums aren't $15,000 a month or $12,000 a month. Their premiums are closer to $30,000 or $40,000 a month. I see that all the time. That's $360,000 a year. All right, 22% on that, that's $70,000. That's $700,000 in increase. What companies can go out there and continue to generate that much more revenue to pad the pockets of these insurance systems, who won't tell you anything, and yet none of these businesses have one customer that would allow them to send them an invoice for what products they're buying that just says, you bought a bunch of our stuff and send us $50,000. Well, that's what's wrong. We're trying to lower the cost of health care with premiums that do nothing more than add cost of health care. Let's start with one very basic fundamental reality. Unless you know your costs, you can't control them. All right. This is a roundabout way of explaining what we do at Employers Committed to Control Health Insurance Costs. We absolutely insist that if an employer needs help, they need to restructure and reshape the way they use the insurance system, but not just by being shown a process, but by taking the time to understand the reasons why and what the underlying dynamics are. We show a small employer what's wrong. We unbundle the components of what comprises these programs. We want to isolate the cost of insurance, which is only a small component of that example I just showed of $12,000 a month. That portion of a premium, which is maybe $4,000 or $5,000 or $6,000, represents a premium to hire a third party to take a risk for what they don't know. That you need to minimize. That's not based on utilization. That's based on risk. That's what all insurance is based on. That's a fixed cost, as is the cost of administration, which is insurance companies' jargon for hiring an accounts payable system. They handle your claims. Now, the rest of it is what's known as reserve for claims. Large employers control that. They control that money. They, therefore, can customize what they use that money for. They, therefore, can position themselves to only pay for what they use, not pre-fund blindly like this model I just described for a small employer. They also then get the middlemen out of the way. And they're not using premiums to pay for health care. They're using dollars to pay for health care, which is a commodity. That's not some mystical, fabrication that drops from the sky that we have to go through all these other third parties to get to. Therefore, there are contracted institutional discounts in the form of medical networks, and that's a story for, another episode here, that already have pre-contracted, agreed upon contractual discounts that large employers are able to take advantage of directly. And therefore, they're buying the same services at about 40% less than the small employer is, with a premium that adds about 40% to the underlying cost to begin with. Also, they know their cost. A pharmacy, the same way. Prescriptions, are accessed either by working directly with a local independent pharmacy, which you can do if you control your money, but also the middlemen that arrange for pricing on pharmacy are known as pharmacy benefit management companies. Express Scripts, Caremark, they're examples. The big ones are owned by the big insurance companies. They add unconscionable markups behind the scene to the cost of prescriptions. When you use an independent pharmacy benefit management company, the cost of the very same prescriptions that people need are substantially less in cost. They're not as predatory. And the insurance company is out of the way also. That also adds their cost to a prescription that is accessed with premiums behind the scenes. So you get rid of the middlemen. You only pay for what you use. You don't prepay for what you don't use. And you work with professionals in the medical and pharmacy world whom we've gotten involved in this to be able to get advice, guidance, understanding, and get down to basic fundamental reality. There's a cost to healthcare. There's a cost of prescriptions. And every group has people within the group that have people who have medical needs that are already in place. A diabetic, for example, needs certain drugs for the rest of their life. Do we go to an insurance agent with a premium, or do we go to a pharmacy with a product? And think about this for a minute. The example that I just mentioned, this small employer in Central Illinois with 9 employees, they're buying prescriptions with premiums. The cost of prescriptions to this group using premiums just went up 22%. I guarantee you, if they go to the same pharmacy on March 1st that they were going to on February 28th, the cost of the same drugs that's going to cost 22% more with a Blue Cross card will cost exactly the same thing with a Mastercard. Think about that. And the employer or the customer will know what he's paying. He's know what he's buying. He knows what he's being charged. So if you really want to get costs down, use your Mastercard, not your Blue Cross card. Put the money in the bank and use your Mastercard. You have to have an insurance component, but let us show you how you do that. And from the employer level, that can be done. This is the result of what I'm just telling you. I did this for myself years ago. because I got disgusted with the insurance system because they wouldn't tell me. I couldn't find out what my costs were. I wanted to know my cost. I don't want to know what my copay is yet. I don't want to know what my deductibles are. I don't want to know what the premium is. I want to know what I'm buying with the premium. And they wouldn't tell me. And the brokers are of no help. They're of no help. It's the same old party line. Well, the insurance carrier this, the insurance carrier this, the HIPAA this and HIPAA that. But you can save money with health savings accounts and health reimbursement accounts and gap plans and this plan and that plan and everything else. All kinds of peripheral gimmickry. How about let's get to the core issue? Just tell me what the cost is. Just tell me what I'm buying. Let me see what the cost of what I'm buying is versus the premium you're charging me to pay for it with. The insurance companies are entitled to make money, but are they entitled to gouge me? Are they entitled to prevent me from seeing what I'm buying? What business person has customers that they can do that to, except an insurance agent? Makes no sense. So what I learned was this. I set a budget equal to what the premium was when I decided I'm not going to do business with people like this anymore. Companies that won't tell me what I'm paying for with $3,000 more in premium every year than the previous year. I want to deal with companies that'll give me an opportunity to have a structure where I know what's going on. And I found them. The benefits didn't have to change. The manner in which I paid for them had to change. So I changed. So I didn't have to raise my budget for the next 5 years. I had money left over every year. So I was showing employers how to do the same thing. They were having the same experience. So I decided to create a means by which we could do this, in the marketplace. Hence the creation of employers committed to control health insurance cost. And we, along with many of the employers that I've helped, they can help themselves. Everybody's looking for somebody else to give them a magic pill. How about getting involved? How about asking some questions? How about, no longer accepting all of these, excuses and these empty rationale for what is, in my opinion, an absolute fabrication, and in some cases, I'm not saying this in terms of the violation of law, but just as a description of what I see, it's a fraud. It's an illusion. It's a myth. Health insurance is a combination of protection for what you don't know, but a myth to think that they're picking up the tab for what we do know. And that's what we are, and that's what we do.
Do medical networks improve access to healthcare or hinder it?
Medical networks, that's one of my favorite subjects. At one time, the theory of medical networks seemed to make sense. An insurance company would create a network of participating providers who agreed to accept for their services a much lower cost than what they had billed. These began to gain traction about the mid-'80s with the advent of the HMO and then the evolution to the PPO, and became almost universal in the 90s. So the theory behind a medical network is the insurance company is contracting with providers who are accepting lower compensation for what services they bill for. Now, in return for that, the insurance companies say to their policyholders, if you use a network provider, you have benefit A. If you go outside of that network provider, you have benefit B, which is a lesser benefit at theoretically a higher price. So that's known as steerage. Okay, let's come to what networks have evolved to today. They're not a pathway to healthcare. They're a hindrance to healthcare. How many times have people gone to a doctor here or there, an eye doctor, a chiropractor, a specialist, a facility, and they're not in network? So because they're not in network, I have to go 10 miles away to somebody who is in network. What the heck difference does it make at this point? Do you have any idea how much money is being spent on lawyers that are, making all these contracts with lawyers for the insurance company, for the facilities that are creating counter contracts? Do you know that the very same companies like Blue Cross or United Healthcare or Aetna, they don't have one network. They have a whole myriad of networks. So you can have Blue Cross and think you have a Blue Cross provider, but no, not so fast. You only have this Blue Cross network. You don't have this other Blue Cross network. So the same provider who'll take Blue Cross Network A won't take Blue Cross Network B. Who knows about this ahead of time? How many times have you gone to a medical facility and you find out that the facility's in network but the doctor isn't? Or the doctor's in network but the facility isn't? This whole idea of networks should be scrapped. I've had conversations with the financial officer of the Missouri University Hospital System last spring when they cut ties with Blue Cross. And they also cut ties with an independent network by the name of HealthLink that was owned by Blue Cross. April 1st. That means all the Blue Cross policyholders and all the policyholders that have programs connected to HealthLink were out of network that day. Now, did their premiums go down because they couldn't get to, the doctors anymore? No, the premiums stayed up. Did the executives of the hospital system, did their compensation go down because they weren't delivering, access to health care anymore? Like they should have, and they did? No, they got paid the same. Did the lawyers get paid the same? No. Yep, they sure did. Okay. Did the insurance agents get paid the same? They sure did. Did the insurance company get the same premium? They sure did. But guess who didn't have a seat at the table? The patients who are paying the bill for everybody. They don't have a seat at the table. They wait with their hands clenched. Can I see my doctor? Do I have to change doctors? Do I have to go 50 miles away to get a doctor that is in the network? That's ridiculous. So when I talked to this executive, I said, are you guys in the business of providing health care or getting into a room with a bunch of lawyers to figure out ways to prevent people from getting health care, even though they continue to have to pay for it with a premium? I don't get an answer. I didn't get an answer. So we had some people that were affected by that. And so I said, I'll tell you what. You guys are supposed to be in the business of providing health care, right? Yeah. I said, why don't we just make an arrangement where you bill direct, get paid direct, and stop with all these intermediaries, and stop with all this nonsense, and stop with all the contracts, and stop with all the fancy talk, and stop with all the lawyers and all the administrators, and provide health care and get paid for it direct. Wouldn't that make sense? I said, they're willing to do it. How about delivering? He said, that's above my pay grade. I'll have to get back to you. I'm not making this up. So 3 days later, I get a call back from, nope, we can't do this. Our lawyers say we can't do this. Why can't you do it? He said, because it violates our contracts. I said, what contracts? That's why we're talking. There aren't any more contracts. Nope, we can't do it. Now, can anybody tell me these networks make any sense? This is what I see. The networks, the insurance companies, and these facilities have become a medical vertically integrated cartel. They're not insurance companies anymore. They're cartels. Our medical system are becoming cartels. They're gobbling up all the private practices. They control everything. The insurance companies have gobbled up other insurance companies, and they're basically the main three or four: Aetna, Blue Cross, United Healthcare, Cigna. Insurance people, for the most part, that's what they're showing people primarily, because that's what people think it should be. There are other alternatives. So I see so much evidence of procedures being billed at these absolutely incredible, prices, and then they, magically discount it to a lower number because they're in the network. And therefore, we believe we're getting a deal because of this. I want to give you a specific example. This is a client of ours in Kansas, in southwest Kansas. One of their employees had a gallbladder removed at a hospital in a mid-level city. The bill for this removal, gallbladder removal, 1 day in the hospital, $106,000. $106,000. We found out, because we did some research for them, and we found out that the same procedure that would be paid by Medicare to the same facility for the same thing, $13,000. So this employer is in a position to have third parties negotiate for them if they want to. So the employer offered them $30,000, 2.5 times what Medicare would have paid them. And the hospital said, no, we want $60,000. We'll reduce it, but we'll reduce it to $60,000. Well, that's what a network price would have been, $60,000. Now, if they would have done the same thing for $13,000, and the patient or the employer is willing to pay him 2.5 times what Medicare would have paid them, what justification is there, first of all, to bill at $106,000 and reduce it to $60,000 and say that's what we'll take? Now, it's not. It was settled for something in between. But let's say it went to litigation. If you're sitting on a jury, what would your decision be if, a customer, a patient, is offering to pay 2.5 times what this facility would have been paid by Medicare, but yet they're billing $106,000. That's 700 to 800% above what they would have received from Medicare. But out of the goodness of their heart, they were willing to accept $60,000, which was 5 times or 4 times what Medicare was paying them. Now, that's what I see. Do I think networks are saving us money? Nope. I think it's a gimmick that has now given our medical system a license to gouge us while we think we're getting a good deal. The packaging of this is brilliant. The psychology of it is brilliant. The practice of it is disgusting. And they're only getting away with it because no one is asking any questions. You want to know what employers committed to control health insurance cost is? We ask questions. If an employer has some backbone and is willing to ask questions and challenge this kind of practice, and some employers have gotten some backbone when they began to see what we were able to find out for them, they can accomplish something. If that same employer continued to just go get quotes from insurance companies because my broker shops the market, they're going to continue to get gouged. It depends on what side of the fence you want to be on. I chose not to be on the side of the fence that, this system has bundled us into and is holding us hostage. take the money away from them, take the control away from them, and begin to get into the reality of a marketplace that makes sense instead of this nonsense that we become, quite frankly, not only accustomed to, indoctrinated to, and held hostage to. That's my opinion of networks.